My name is Dr. Victoria Katasi. I am a specialist treating children with brain and spine cancers and blood disorders. I am also a health and wellness expert. Welcome to this edition where we are going to delve into burnout and depression, and mostly in telling what's the difference between these two so that people can have clarity to know what it is that they could have or a loved one could have. So when we talk about burnout, burnout is an occupational phenomena which has been described by WHO as being caused by chronic workplace stress, okay, and manifests with symptoms like emotional exhaustion, physical exhaustion, cynicism, or detachment from work. Now, when we talk about depression, depression is actually a mental health disorder, which is actually being stated in the DSM-5. That's where we talk about psychiatric conditions. And it's characterized by you having persistence of certain symptoms. The symptoms should be there for at least 2 weeks persistently. So you'll have persistently depressed or low mood, persistently loss of interest in all your daily activities. Okay, like there's nothing you want to do. You have this persistently chronic stress or fatigue, your low appetite, okay? And in severe cases, it may actually spiral into somebody becoming suicidal. And so they have all these suicidal thoughts that are going on. So it's also important to note that burnout can actually lead into depression. So if you get severe burnout and it's not managed, you may end up into depression. However, not everybody that has burnout gets depression. And also not everybody that has depression got depression because they had burnout. So depression can be an independent disorder that you can actually get on its own. And it can be also part of another disorder that we call bipolar affective disorder, which we call BAD, that has spikes of where there's excitement, mania, and then there is the low where you have the depression. So if somebody has burnout, we've said some of the symptoms they may have may be like physical exhaustion. So you find it difficult to get out of bed in the morning. Even after you have slept, you're tired, okay? Things like mental exhaustion, that even work, you know, it's difficult to think and create at work. Cynicism at work, you're irritable with your colleagues. You're detached from your work. Now, you see that some of these things may look alike, like what depression looks like, okay? But remember, we said depression, these are going to be persistent or prolonged for a certain period of time. And you should have a certain number of these symptoms for us to actually diagnose and say that you actually have depression. So maybe in a previous video that we recorded, we had talked about what causes burnout, okay? So maybe we can look into what may cause somebody to get into depression. One, I have said it may be part of a certain disorder that we call the bipolar affective disorder, which has two manifestations. One, where you are high or excited, which we call mania, which most people call, which most people commonly refer to as someone being mad. That's where people are hyper excited, they are shouting all over the place, they are aggressive. That's the manic phase, but it also has a phase of where you're actually low, and this is the depressive phase, where you can't get out of bed, where you're chronically feeling tired. Your appetite is low, you're not interested in your surroundings or in anything, you're just really apathetic, okay? And you may actually spiral into suicide. So really, when you have somebody who has gotten to a point where there's nothing they want to do, okay? And it's not laziness, it's the fact that I just don't have the drive to even get out of bed, to wash my face, brush my teeth, even preparing myself a meal, like all those things take too much energy that someone will just spend the entire day in bed sleeping. You don't even have the energy to put on TV and watch a movie, like you're just there. You have lost a sense of drive, okay? You have lost the ability to take care of yourself, okay? But also the interest in, if normally you're someone who's interested in your work, you're someone who likes to achieve, like you really just don't want to do anything. Nothing makes sense. You're in that mood, you want to eat, you know, you just want to be there alone by yourself, and you're chronically sad. Like for some reason, you're really sad. You feel really sad, okay? And you'll find that people are practically always crying, maybe by themselves. You know, and with time we've said some people may actually become suicidal because they start to feel worthless. They don't see a reason why they are living. They feel like they are not contributing, like their lives don't amount to anything. And with time they may actually get suicidal and commit suicide if they are not helped. Whether burnout or depression, each of these conditions is actually manageable, okay? Now, burnout will be easier to handle, because remember, you're able to identify a cause, okay? And the easiest way to tackle a challenge, if you're able to eliminate the cause, if that's possible. So if it is factors in your workplace and there are factors that can be modified, then you can discuss this with your superiors, but also it's personal factors on how do I better organize my finances? How do I create better work-life balance? How do I learn to say no because I'm overwhelmed and not taking up everything by myself, or learn to delegate work? These are things that you can deal with, but also there are strategies that we can actually use to help somebody overcome the burnout, teach you how to take care of your mental health, okay? Things like teach you strategies like meditation, strategies like journaling, strategies like positive affirmations. Also making sure that you put in time to take care of yourself, like exercise, because that's important both for your physical and mental health. Spend time in nature, do things that actually uplift you, excite you. Read widely, okay? Expose yourself to new environments to help you grow, stimulate your brain, and find time to engage in other activities, okay? Have a proper work-life balance, work-life integration, have proper boundaries. That can be the strategies that you use to overcome burnout. Now, we said depression. For it is a mental health illness, really. And so for it, you actually need medical help. Okay, you need to get in touch with a therapist, you need to get in touch with a psychologist and a psychiatrist. And for this, we actually use drugs. Okay, there are some drugs that are actually out there, like some serotonin, SSRIs that we actually use, things like fluoxetine. Okay, now it's not advisable for you to go and buy this over the counter, because what you need may be more than just you buying this drug. You need a therapist to actually, evaluate you, see how severe your depression is, and then walk with you on this journey as they prescribe what drug you will need and which type of combination of drugs. But also there are other therapies that we can use, like the CBTs, electroconvulsive therapies, okay? Depending on how severe your depression is, plus the support that you will need from friends and family, depending on what caused you to be depressed, because people may become depressed for different reasons. Maybe I miscarried and lost a child, or I lost a spouse, or my business failed completely, and I don't see where to start from, things like that. So also having the support from friends and family to kind of begin again where you are, all that, as you're getting the medical help as well. So yes, this can actually be managed and treated. Okay, so I am a burnout consultant, and I have created a strategy to help individuals to actually avoid and also overcome burnout. So if you feel that you are suffering from burnout, or may have burnout, or in a position where you are at risk of getting burnout, you can actually reach out to me. My link is in the bio. I've also created a course on how to avoid and overcome burnout for high performers, and this will be available on my website at a later time. You can access it at a fee to also help you walk through this journey of avoiding burnout or overcoming it. So if you would like to work with me in terms of either health or wellness, burnout, you can find my contacts in the link below or in my bio, and you can reach out and we can meet up or get onto a call, and I can see how I can help you. Thank you.